Well, good afternoon, everyone. That was a really cool brief look at Prides from long ago. Really makes me miss having those in-person things, but I know that'll be coming soon, hopefully one day. So just want to say thank you, everyone, for tuning in today to today's live stream on sexual health as self-care. My name is Marvin Hanashiro, and my pronouns are he, him, his, and I'll be serving as your moderator today. This live stream is our official kickoff to STD Awareness Month. And today we'll be speaking to San Diego community leaders who work every day to foster equality, respect, and education to the LGBT plus community and beyond. So without further ado, let's bring them all in.
Hi, Marvin.
Hey, everybody. Nice
hey,
to see you all. So I think most people need no introduction, but for today's purposes, of course, I want to make sure everyone introduces themselves. So I'm going to ask first Deja to introduce yourself.
Thank you, Marvin. Good afternoon, everyone. My name is Deja. My pronouns are she, her, hers, and I work at the San Diego LGBT Community Center. I am the community health educator and advocate. I'm also a Pisces with the Capricorn Moon, Cancer rising, and I'm excited to be here. And I'm going to popcorn it to Gabriel.
Yeah.
Hello, everyone. My name is Gabriel Wagner. My pronouns are he, him, his. I am Associate Clinical Professor in the Division of Infectious Diseases and Global Public Health at UC San Diego.
And so that leaves me. Hola, buenas tardes. Me llamo Fernando Lopez. Soy el director ejecutivo de Orgullo San Diego. Hi, my name is Fernando Lopez. I'm the executive director of San Diego Pride, and I use they, them, their pronouns. Thanks for having us.
Awesome. Well, like I said, it's great to see everyone here today. So for today's conversation on sexual health and self-care, I have a few questions that I'm going to ask everyone to contribute to if possible. And then at the end, if we have time, I think we're going to open this up to audience Q&A if possible, okay? So for the first question, I'm going to ask that, so sexual health can be interpreted in so many ways. What does it mean to you personally and in the context of your work in San Diego's communities? And how do you talk about it? Deja, would you like to start us off?
Sure. When I think about sexual health for me, it's no different than how I think about my physical health and my mental health. So to me, it's all aligned. It's all in alignment that I work on. So getting tested regularly, having conversations around sexual health. And then as far as my work goes, we get a lot of different folks who come into the center for an HIV test, folks with different orientations, different gender identities. So we know that folks are having sex a lot of different ways. So it's important that when we discuss sexual health, it's really client-centered. We are very sex positive. I like to tell folks I don't yuck on anyone's yum. So yeah, just non-judgmental and being there for the client. For me, it's it's an easy conversation to have. I love this kind of conversation. So to me, I just come in for like the big sister role. I feel in that, let me be your big sis, let me be your cousin. Let's talk about all of the things, and I will, give you all of the tools. And I'm sure we'll get into that later, but you have options. So I think a lot of people don't realize that they have options. So when it comes to sexual health, it is very personal.
Does anyone else have any comments or questions when it comes to your views?
I love Deja. I love your "don't yuck anyone's yum." Like that is just something that we say here at the Pride office all the time about all sorts of things, right? Like our community is just so diverse, and there's no one way to engage with community that makes someone else feel comfortable. Like somebody might not like this thing or that thing, and so finding ways to meet people where they're at and just listen and never yuck anyone's yum. I'm super here for that, and I'm a very sex positive person. I would like to think myself, and obviously I work for San Diego Pride, which is a very sex positive organization throughout our events, whether year round or meeting folks where they're at too. And so I think I find that just in my daily life, having those conversations about sex and intimacy with my friends, and being a mentor to other folks who are, of any age, but especially folks who are maybe younger and haven't engaged or explored their sexual health and really what that means and how you can help guide your folks in your everyday life. I mean, I was just chatting with a really close friend yesterday who's maybe, I think, 6 or 7 years younger than me, and just talking about consent and conversations with your partner and how to explore that. I think just being that person for someone in your daily life is really important.
Mm-hmm.
And I think it's important to feel empowered and to know that there are a lot of resources and options. We are lucky to live in a place like San Diego that does have a lot of resources and options. Not a lot of places have the types of options and resources that we have. And so if there's ever a time to be curious, be interested, learn more about sexual health, to jump online, trusted websites, trusted sources, and get tested, and learn more about things like STI prevention and HIV prevention.
Mm-hmm. Well, and so many of our young people, right, we as queer LGBTQIA folks, like we didn't have sex ed that was competent for us growing up. And so that is just, we had to learn it out through our queer mentors and the veterans of our movement, just through independent connections. And in a year where we've been so disconnected from folks, that sort of like learning just isn't really there. I know we're going to get into a little bit of that later, but I think that's a huge part of it too. And I know the center in particular and San Diego Pride and some of our other youth serving organizations have really worked hard with the school district here and at a state level to try to bring some of that sexual education to LGBTQ competent sex education to our youth, but it's an ongoing process and not everyone has access to it. So even forums like this where folks can see some queer folks talking about sex is new and exciting and accessible in a different way.
Right. And when we talk about accessibility, we're talking about, including communities that need it most, that need this sex education the most, a diverse and inclusive sex education. And so when we're speaking to our youth and we hear language like gay sex and straight sex, we have to take a step back and say, well, one is reproductive sex and one is non-reproductive sex. And no matter if you're cisgender or transgender, you can have non-reproductive sex. So let's talk about it. Let's break it down. And then the kids are like, oh, that makes sense. So, new generation, new language, it's all up and coming. And I think sexual health and wellness is going to be part of a conversation when folks go get a physical done or, any other medical necessary exam.
Yeah, our understanding of gender, sexual orientation continues to expand. I think that's such a great point. And so even what, culturally competent sex education maybe some of us may have received as younger people, like that's constantly changing and we're constantly learning. And UCSD Health and like Good to Go especially, I think does a really good job of educating folks. And obviously the center does a lot of that great work too. So just we're always learning and try to help everyone else learn as well.
Yeah, I think that's pretty great. I mean, everything you said really resonates with me too. Just, I mean, Deja, I'm going to steal that. Don't yuck on anyone's yum all the time now.
That is pretty good.
I'm a sucker for alliteration. And I also really love what Fernando and Dr. Wagner mentioned about finding resources and also talking about sexual health and not just the act itself, but things like consent and how to do things prior to, actual any activities or whatnot, understanding that as a part of the whole spectrum. So that's great.
Yeah, I mean, I just want to, like, sex is and consent, if we're going to talk about that, is an ongoing conversation, right? There's consent before, there's consent during, and that can constantly change too. And that is part of sexual health and mental health dialogue that, we don't always consider. It's like, what do you want to do? How do you want to do it? What feels comfortable? And that may even change in the moment. And being responsive to that, being vocal about that, and feeling free and liberated to vocalize your sexual concerns or your sexual needs and desires, even with your partner in that moment. We need to be reminded that we have the empowerment, like we have the ability to speak about our own personal needs in the moment and have those needs be respected.
And another thing that you brought up, Fernando, is the fact that, sexual health is really an enormous topic. It's a dimension, really. So it's not like you learn how to build something or you learn a defined set of instructions. These aren't defined sets of instructions. This is human behavior. And so you will never learn everything. You will always be learning. And so this is where continuous education, continuous resources, learning, you can learn some basic concepts and some basic structures around things, but the actual universe is never ending. It'll always be changing. And so keeping up to date and continuous education, continuous learning.
I love that, Gabe. I want to steal that too, because we're constantly evolving human beings. Our experiences change, our intimacy and our desires change. It's not like, learning two puzzle pieces that just get fit together, right? Every human being is individual. And so learning what that experience means between two individuals is a constantly evolving experience, even for long-term partners. Let alone a one-night stand.
Well, that's great. So let's go to our next question. So what is the landscape of STIs and HIV in San Diego today? And so I'd like Dr. Wagner to start us off with that one, please.
So STIs, which is short for sexually transmitted infections, by the way, or STDs, also sexually transmitted diseases. STI is the more commonly used term nowadays. They have been increasing, actually, nationally and in California and in San Diego over the last 10 years, and really since they started getting reported. So the rates of STIs have been increasing every year. The latest reports that we have are from 2018, 2019, and the rates of the reported STIs, bacterial STIs, that is gonorrhea, chlamydia, and early syphilis, have been increasing. And in 2020, the COVID-19 pandemic happened. And what we saw was that right after the first lockdowns started taking place in early 2020, there was a significant drop in the levels of gonorrhea, chlamydia, and syphilis. And this probably corresponded to the fact that people were not able to meet number one. Number two, we're not able to go anywhere to get tested. In late 2020, those numbers started to increase again, consistent with the fact that things started opening up again. What STI experts, though, and many of us that work in the field fear is that the lockdown prevented, or it probably made it difficult for folks to find places to get tested. But human behavior does not change. And so what many of us fear is that actually the rates will probably increase dramatically because there's going to be a lag time, a catch-up time, where people are, rates are still out there in the community. These infections are still out there in the community. And as more and more places start opening up and more people start getting tested again, there's probably going to be a catch-up, consistent with the fact that each year STIs in the U.S. and in California and in San Diego have been increasing consistently. And another note is that STIs, the burden really is on a handful of groups in the community. So it's not spread throughout. And what are the handfuls groups? It includes LGBT folks. It includes Black and Latinx individuals, transgender individuals, gay and bisexual, and what we call men who have sex with men. And especially young people too, unfortunately. The brunt of new infections is actually carried by folks aged 15 to 24 years old.
So yeah, I mean, from what I'm hearing you say then, right, it's that basically, of course, people are still getting busy, but they just weren't able to access the services that they needed, right, to take care of their sexual health long term. And so if I heard it correctly, then that means that the concern is that soon to be, we'll see the numbers actually match, or if not go above some of the rates we saw prior to the pandemic. Is that correct?
That's right. That's right. And hopefully, as everything starts opening up, people will be taking advantage of testing services and health prevention services, sexual health prevention services. But if the past trends are to predict anything, that's probably what will happen.
You know, one of the things that this is bringing to my mind, Gabe, is how every year in the lead up to San Diego Pride, we partner with AVRC, Good to Go, and UCSD Health to produce the Testing for Tickets program, where hundreds of folks in our community get tested. And they're just one of many providers that we partner to do that with. And that's just in the lead up to Pride. And that's so hundreds of folks just through you all alone. And then at Pride weekend, you know, you all have an HIV and STI testing site at the festival. And there's typically 3 to 4 HIV, STI testing facilities at San Diego Pride during Pride weekend. And a lot of folks don't necessarily know that if you're not there looking for it, but we can test 1,000 to 2,000 folks over the weekend. And so without that sort of additional promotion and access and sort of the incentive to get tested, because you get tested and then you get a free ticket to San Diego Pride, there's a lot of folks that weren't engaged in that process for this last year. And it was one of the, you know, yet one more sort of the collateral damage of the pandemic. We didn't have that program last year.
And even if folks are not interested in an HIV test right then and there, they could at least get more information on it. They could get information about how to make an appointment, information about PrEP or other, you know, health services for another time. So the fact that it is at Pride is a huge deal.
Oh yeah, and then, you know, with folks like UCSD and county and the other folks who were there, you get, right, if you get your test, you get immediately connected to that resource. You get immediately connected to resources and care. And so that was just not there.
And this, what I was saying earlier about, you know, being lucky to be in San Diego is that there is things like, you know, the center and San Diego Pride and the AVRC the ticket program, actually, Marvin is heavily involved in. But at the same time, what would be ideal is, these efforts are great, but they are centered around Central San Diego. But there are youth and other folks that live in other parts of San Diego. It would be ideal for public health departments and more initiatives to really reach out into the community so that sexual health screening efforts can take place more continuously and with more accessibility throughout the year, as opposed to the Pride, which is fantastic, and we all take advantage of it, and it's one of the benefits of living in San Diego.
Mm-hmm. Well, and then it's just like knowing that there's a space that's there for you, that is intentionally built for you. There's something welcoming for that, even if it's your first experience. I think my first HIV test, no, actually now I'm thinking that my first HIV test was at a clinic, but I think my second HIV test was at San Diego Pride. We're like 20 years ago. But there's something about that, right? Because going into just a medical facility, or maybe it's not covered by your insurance, that can be scary, and you don't always get an LGBTQ culturally competent or sensitive physician that's there and welcoming for you. So if it's your first time, that sort of can help get past your initial fear of what that process is even like, knowing that the person that's there is there at Pride intentionally for you.
100%. And I like to tell the youth too, that you don't necessarily need to have sex to get an HIV test. If you just go through the experience to know what it's like to even get a test, it won't be so scary when you actually when you start having sex and you need to get a test.
Mm-hmm.
That's
that's terrifying. Yeah.
Yeah. And any youth who are watching, in California, you have to be at least 13 years old to get an HIV test without a parent's consent.
Nice tip, Deja. Yeah.
Auntie Deja, she got you.
And I really love that, because I think for most of us, testing can be very intimidating and scary. And as Fernando mentioned, not every place is inclusive or is culturally competent. And so I know I've personally faced those issues at certain clinics, not necessarily in San Diego, but in college and in my 20s. And so I think that's really it's a nice tip too, to be able to potentially at least kind of go through it, just to kind of know how the wheels are turning, and so that you're not as shocked maybe, when you first go through it, especially if maybe you have a concern of something, so it is not so overwhelming. But yeah, I love that tip. So along this topic, we've mentioned how COVID-19 has been impacting STDs or STIs in San Diego. So as a follow-up, I'm wondering, are there any other ways that we're noticing that the pandemic has been impacting sexual health as a whole?
So I know that personally, I'm like, what's sexual health? I've been in pandemic landia, and very grateful that Pornhub extended their free, experience. It was a great assistance. But one of the things I think really quickly we saw in the community, even from our own folks, was a lot of shaming, which that was sort of this weird internalized homophobia that folks were spreading without actually real knowledge or understanding, that people were going out and using apps and hooking up and like really shaming folks for that. But that wasn't actually necessarily the case, right? Folks were scared right away. Folks were locking down. And there was still some internalized and external fear and shame and stigma that was associated with our community and our behavior without actual knowledge, right? And so that was just all stereotyping. So that was really unfortunate to see, especially at the beginning of the pandemic, throughout. And I would love to hear what Deja's experience, what the centers heard, but a lot of what we heard was about loneliness. And that impact on sexual health and how that impacts your mental health overall, right? We've all been through it. We've been isolated. We maybe haven't had as many partners or any partners in the last year, haven't been touched, haven't been kissed, haven't been hugged, and all those different degrees of intimacy, let alone intercourse or, other, as Deja, what did you say, non-reproductive sex, right? So many of us have not had that for a long time, and that can also impact your mental health. And so that's one of the things that we've really been hearing a lot, that people are feeling disconnected, lonely, and really curious about what safer sex looks like and what harm reduction and mitigation looks like in a pandemic environment. Like, who do you trust to bring into your home, to be that close to your body? When, not only talking about STIs, but talking about the impacts of COVID and the pandemic.
Yeah, and picking off of Fernando's comments, I think, there was a lot of misinformation in the very beginning. There was a lot of information comparing the COVID-19 virus to the AIDS HIV epidemic. Mm-hmm. And so the calls that we were getting were a lot of folks who were scared, but folks who were on PrEP. Can I get COVID up since I'm on PrEP? And it's like, well, let's break this down. Let's talk about how HIV is transmitted, and let's talk about how COVID-19 is transmitted, Mm-hmm. So it was breaking down a lot of that stigma. But I want to talk about the positive changes that our pandemic has brought us was our drive-through testing. So many folks go into a medical facility for the very first time to get a test, and how nerve-wracking that can be, how scary that can be, not knowing who the test is, who the tester is, how the test operates, how long you're going to be in the waiting room. You have that hospital smell or medical smell, so for it to happen in the comfort of your own car, you don't even have to, it's like driving through Starbucks, honey, like it's simple as that. And I think that is so easy and convenient for folks not to get out of their car, and just roll up, beep, beep, skirt, how you doing? Here for my test. And, and it's quick and easy, 20-minute results. And then you hit it after you leave with some swag, of course.
Yeah, I love that.
I'm glad you brought that up, Deja. I think
positive change.
Yeah, absolutely. I think in the healthcare, the healthcare systems, especially UCSD, had to adapt quickly to the pandemic, and that resulted in widespread implementation, rapid implementation of telehealth and telemedicine, and how to just streamline things to make things quicker. I work at the Owen Clinic, where we developed completely nursing-run STI visit program. So people don't even have to make a formal appointment where they have to see someone. Just contact your physician. You want to get tested, drop off your specimens, and that's that. Walk in and out. So trying to, one of the unintended consequences really was to try and accelerate and streamline and make some of these things. Some of these processes more confidential, more convenient.
That's great.
Yeah, that's really interesting to hear. Fernando, I think we all felt a little bit of that loneliness and lack of connection, right? Just like you mentioned, as simple as a hug or a kiss, we were all lacking for so many months, and some still now. But I also really loved hearing some of the positives too. And I'm sure, I think every one of the groups here, like the Center, San Diego Pride, and UC San Diego Health, all pivoted and offered things, I believe, virtually, whether that be medical visits, support groups, the drive-through testing. And Deja, I think you're onto something. You might have to add Starbucks as something to go with get your HIV test.
We'll have your Starbucks, your PrEP, your HIV test, your ART meds, whatever you need.
Yeah.
I love that.
So just as a side note, did you ever see, I think there was questions I always had before. Sometimes it was hard to activate people prior to the pandemic. It could be difficult engaging people that may not want to come into a certain facility or a support group. Did you at all see any maybe increase, or was it the same when people pivoted to the more virtual platforms?
I think it was a little bit of a mix. I think, working mostly with the trans community, a lot of the times we're in situations where we're misgendered or mistreated. And so sometimes being in the comfort of our own home and going on the little Zooms, it works out. And so we know that there was an increase for sure in our groups, not only in San Diego, but across the country. Folks were hopping in from around the country just to see what we were doing and to connect with other folks. And that was really nice to see that in a global pandemic, there was still community being developed and made and nurtured.
Absolutely. We saw a huge increase in our attendance to our programs. We flipped around pretty quickly. And it was just incredible to see how much folks came and wanted to be present in space when we were all feeling so disconnected. And I echo what Deja said, that we ended up seeing folks from all over the country and all over the world being like, this is the first time I have access to this sort of space and this sort of information. So, at Pride any given year, like at the event itself, not just our year-round programs, but the event, we usually have around 150 to 400,000 people, depending on what's sort of going on politically at the time, how big those crowds are. And so this last year, we had about 750,000 people tune into the messages and the community space we were bringing. So that was, we never could have foreseen reaching that many folks. And then I'll say, like, recently, there's been a decline in that virtual space as folks are starting to creep out and feel a little more safe, and the vaccine rollout is, sort of happening. So it's going to be a mishmash for a while, I think, as people relearn what they're comfortable with their own body. And I think that goes right back to our conversation of sexual health and consent. Is we had this really unfortunate lesson that we had to learn in the pandemic that was still about body autonomy and risk mitigation and talking openly with your roommates, your friends, your family about what you consent to have happening with your body when you're in another space. But this time we're talking about a pandemic, right? And in a way that this virus is transmitted differently. But there were so many parallels to the conversations I think we have when we're talking about sexual health and body autonomy and consent and risk mitigation. So it was very interesting for me to sort of like look at that and see those parallels. I don't know if any of you like experienced that.
Yeah, go ahead, Deja.
Go ahead, go right ahead. I've been speaking a lot.
Well, you just made me, you triggered a couple of different ideas in my head. But one thing from the standpoint of the healthcare system is many of us have worked in using this concept called harm risk reduction, which is sort of like trying to frame the patient's experience with as little judgment as possible. Now, earlier you mentioned that during the pandemic, some folks were a little judgmental when it came to the behaviors of others. I experienced that in my own clinic, and gently reminded folks that these are people are going to do what they're going to do. It's about meeting the user where they're at, providing tools. It from the standpoint of the providers, really it should be, and thankfully many of us that work in the field, it really should be about understanding the anxiety, understanding the stress of engaging with the clinic, and about really you can do what you can do. You can have fun. Let's talk about ways that you can enjoy yourself in a healthy way, rather than these are the STI statistics, and you should do this because of this, or you're going to get this. This will be the consequence. The framing is really important, and some of the things that you guys were saying made me want to say that.
Yeah, and I just want to add that we tell our clients, to make choices that are right for them. Again, sexual health is very personal, and it's very individualized. So these folks who are out there having fun, we just got to ask the right questions. How are you keeping yourself safe if you are, and how to remain safe.
Mm-hmm. I know my DMs were like just popping all through the pandemic of like flirty pictures and texts. That was a safer way of engaging in sexual health.
Right. But even that conversation, I think kind of the conversation around sexual health in this pandemic extended, when we talk about even how we talk about sex work. I think before we talked about sex work as like, folks who are on corners or, the street or, engaging in sexual activity, with their bodies. In reality, we see virtually that you can engage in sex work, paying somebody, subscribing to a subscription is supporting that sex worker.
Mm-hmm. Yeah, I think a lot of folks leaned into right, that for either their own ability to continue in their employment or having the resources that they need to pay rent and just live, right, turn to sex work. And that was something that I saw a lot of folks in our community turn to. And there should be no shame or anything around that, right? If that's what somebody is making the choice to do with their body and they feel empowered to do that, and they're in control of that situation, power to you. Celebrate that, like own that. And yeah, I'm so glad you brought up the OnlyFans situation.
I mean, when we talk about self-care, we talk about, what feels good, right? Whether it's in the bubble bath, reading a book, having a glass of champagne, doing a face mask, things that make us feel good. Pleasure is the same thing. Pleasure should make us feel good. Sex should make us feel empowered, not powerless, And so folks who are, showing off themselves in front of the camera, that's their part of their sexual health and their wellness as a whole, mentally, physically, whatever it may be. And then as far as, masturbation, stress reliever, hello, these folks are not running around here stressed as hell. Can I say that on the live? Am I allowed to say that?
Yeah.
What I mean? So like when we talk about sexual health, self-pleasing, you really want to make sure you know what you like, what turns you on before you have somebody else try to turn you on,
Mm-hmm.
Yeah, Deja, that brings me to my next question about sexual health and self-care. So everyone's already been talking about how sexual health is complex, but it's beautiful, but self-care as well. And so I just wanted to read something real quick, that the World Health Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a healthcare provider. I know at Good to Go San Diego, they often talk about sexual health in terms of self-care. And Deja, you were just talking about that right now. Now, as we all continue to live under the conditions of the pandemic, as Fernando mentioned, some people are starting to eke out, dip their toe in, start walking about. Some people are still kind of like, isolating themselves as well. Self-care is on a lot of people's minds. And Deja, you mentioned things like self-care can be as simple as a bubble bath or having a glass of wine after a long day of Zoom meetings, which I understand very well. But it's much more than that. So my question is, do you think San Diegans or anyone can incorporate sexual health into their self-care routines? And if so, how? So Deja?
I mean, absolutely. I think sexual health, again, like Dr. Wagner said, it's a broad thing to talk about, and it could mean so many different things. It could mean, going to go get a test, whether it's HIV or STI. It could be having a sexual health conversation with your friends, just have a nonchalant conversation, back and forth, whatever. So, we think about meditation for mental health. We think about physical activity for physical health. Sexual health also should encompass that, and it doesn't necessarily need to be immediate self-pleasure. It could be something as just having a conversation, reading an article about sexual health and wellness. So it can encompass a lot, and it's also specific. So when we talk about what's your tool, we're talking about, all of the different sexual health things in your toolbox. I think before in the early 90s, late 80s, condoms. We still hear condoms, right? But now there's PrEP. Now we know that, undetectable means untransmittable. We now know that a lot of lube helps, so there is a lot of different tools that you can use not just condoms. Condom is just condoms and, you know, so self-care, get into it, you know, do your research, figure out what's right for you. You know, if PrEP is right for you, let's talk about PrEP. If condoms are right for you, let's talk about condoms, you know? So, yeah.
I really like what you said to Deja about sexual health self-care can just be those conversations with friends. And one of the things that I'll share, and I think some of my friends are watching, is that this year was rough, right? This year was, I mean, rough is an understatement. Last year was trauma in so many ways. If we're talking about the pandemic, if we're talking about the violence against the Black community, the API community, the rise in hate crimes towards the LGBT community, there's been so much very real trauma. I mean, we also went through an insurrection like 2 months ago, or like there's been a lot. It's been hard. And so when even having like happy hour cocktails with my friends, and like if it's over Zoom or whatever, there's so much that we're talking about that has been trauma in the last year that we would sometimes say, okay, wait, pause. Can we just talk about sex? Like, can we, whether we're sharing old stories or asking questions about people's respective partners and sexual health, like we would bring it back to sex just to like bring some joy into the conversation and, you know, some pleasure into the conversation. And it was such a nice like mental health break for us and my friends. And we talked pretty actually then openly about between my friend group, what a saving grace that was for us to feel like we're in a safe space where, you know what, the world is hard and we just want to talk about sex and sexual health. And that's like a fun thing to do. And now that things are opening up a bit, you'll see me up and inside out and up at like the top. And there, if most of the time, if you want to know what we're talking about, my friends there are talking about sex because that's like mental health at the moment.
Yeah.
Absolutely. And same with my friends. And I think we when we talk about sex or intimacy, it sometimes goes into a little bit deeper conversation. You know, for me, having a trans identity, I have had sex as, you know, as a male, as a gay boy, and as a girl. And so, you know, talking about what's that like for me is really healing for my own sexual health and heals, you know, past trauma or helps me unpack things that I need to work through. So, you know, talking about sexual health doesn't necessarily need to be, you know, girl, you a top bottom verse, you know, let's, you know, spit roast all of this, you know, shenanigans. It could be right. It could be as simple as just talking about what does intimacy mean for you? You know, what does pleasure mean to you? How do you connect pleasure with your mental health, with your physical, you know, all of these things. So it's, again, huge thing to talk about.
Well, and yes, I won't obviously name the friend, but I was just talking to a friend the other day, and you know, we were talking about some intimacy issues with their partner, and like just the ability to have that longer conversation. And you know, when you're talking about people who are in a monogamous relationship, right, there's a sexual health conversation there too, and they, you know, people have been trapped with each other for a year, maybe. Like, I mean, my roommate, love you, Derek. I was gonna call him out. We have each other's last damn nerve, right? Sometimes, and we've been like stuck in our house together for a year. But so for a couple who's in a monogamous relationship, what does that mean for their sexual health? And what does that mean for what they want? How are they having a conversation? And just being able to have a friendship where you can say, I'm having this scenario, this situation with my monogamous partner, and I don't know how to bring this up with my partner. I don't know how to talk about my desire for foreplay or my lack of desire for foreplay. Like, you know, how rough or how gentle do I want them to be with me? And, you know, for so many years we've operated this way, and, you know, maybe I've mostly bottomed, but now I really want to explore topping. And how do I have that conversation with my long-term monogamous partner? And that those things may change, and having a friend that you can have that conversation with and then bring that back to your monogamous partner as well, or any partner that you have, with, you know, polyamorous or non-monogamous, that's really important, right? Because that all goes back to consent, that all goes back to mental health and body autonomy.
Communication is really so important, and to have the proper safe space to communicate your feelings openly, and to truly communicate your desires in a way that that other folks can be supportive. One thing I wanted to go back, Deja did such a wonderful job of talking about sexual health, self-care, and I wanted to, also follow up on that. It is, very sexual self-care could be highly variable, and sexual health and what one needs to do to be healthy, have a healthy sex life can look different for different folks. And so, for what from the medical standpoint, right? People that have certain risk factors for STIs should get tested for STIs frequently, at least every 3 months or every 6 months, depending on the level of risk. Now, what that means for individuals, though, is, and this is where I would say, number one is to learn as much as possible, and number two, to develop a routine. So if I'm someone who through learning about myself, I learned that I enjoy threesomes, and I learned that I enjoy having having sex with a variety of guys. Then I will learn that the every 3 month STI testing schedule is more for me. And I will learn that condom use and perhaps PrEP will be more what I would need to incorporate into my routine to be healthy. But perhaps I learned that that I don't need any of that. That actually I like to meet up with one guy once a month for mutual masturbation. Yeah. And maybe I learned that I don't need PrEP. And maybe I learned that STI testing for me is fine to do every once in a while, but I probably need to do it only once a year. And so how you incorporate the routine for you is important. Learning what you need and learning how to incorporate it into your daily life.
I love that routine part. I used to always find wherever my clinic was, like what was the closest oil change place, so that way I'd be on the same 3 month schedule for my oil change and myself. Like, okay, I'm gonna go check the car's oil. I'm gonna go check mine. The same while it's in the shop. I'm gonna go over here, and definitely that worked for me for a very long time. I was definitely much more, I think, sexually adventurous in my 20s and early 30s, and was on PrEP. I think I started PrEP 8 years ago. And so there was a time where PrEP made sense for me, and getting STI tests made sense, like every 3 months. And I'll say in the last year, I'm not on PrEP, and I haven't gotten STI tests because there's no need. But that's gonna hopefully change soon.
Yeah. Fernando, I think that's an amazing tip, to think about that too. And as Gabe mentioned, to incorporate the self-care or the STI testing into your self-care routine. And so if getting your oil change every 3 months, you knew that was going to happen every 3 months. So let's just tag on the testing on top of that and just make it routine. That's, I feel like, a really amazing tip, and something that's you don't have to think about as much, right?
And continuing to learn about different options from reputable sources. You go to places like Good to Go or the Center or San Diego Pride, but there's different formulations of PrEP coming on the horizon. Long-acting injectables, the integration of PrEP along with contraceptive devices for women that are at risk for HIV. A lot of different options are on the horizon, and so this is where the continual learning will come into place, to really kind of be, use everything in your power to be as healthy as possible.
Well, that learning too is continuously ongoing, right? There are medical advances all the time. The way in which HIV, STI test you're taking, what the time frame is for that test, when the results are going to come out, what window does that show you? All of those things in my lifetime have changed, and even my sexual lifetime have changed dramatically. And so it's stuff that I'm constantly having to learn, and all of us who do that work are constantly having to relearn. And it, like you said, it goes right back to like, here's good to go. You know, you're in a safe, welcoming environment where they're going to take the time and the care to educate you with compassion.
That's great. Well, so those are all the questions that I had for you all today, but I think there's one I did see that came in through our Q&A, and it's a little bit two-parter, and I think kind of heavy, but why do you think sexual health hasn't already been a part of most folks' self-care routine? And how do we combat any barriers that currently exist?
Ooh, that's a good question. I think it isn't part of people's routine because people are still afraid to talk about it. I think people are afraid to be judged. I think people are intimidated to talk about what their yums are. You know, they don't want anyone to yuck on them, you know? So yeah. It's just and from what my experience is being scared, not knowing how to bring it up, how to talk about it, what even to say, you know? So I think how we've been talking about this whole time is finding a group of friends or a person that you feel absolutely comfortable with, you know, sharing something as intimate as sexual health, as, you know, your sex life. So I think that's how we combat some barriers. You know, you gotta find your people.
There's a lot of stigma and internalized homophobia, transphobia. These are real barriers to even beginning to talk about these things. If there's actually, it can be difficult to even verbalize some of the things that we are talking about. You know, some people find it hard to say penis or vagina, and so there are cultural reasons why some of these things should not be spoken out loud, and so these are some of the reasons why it can be difficult for some folks to incorporate this into their routine. Once you do become empowered, once you maybe like us here in this panel, once you are able to talk about these things, once you get agency to do the things you need to for yourself, then, you know, quickly you realize, oh, you know, this is actually quite easy. But there is that hurdle, and I think that hurdle is a very real cultural barrier for many folks in the community.
Mm-hmm.
Yeah. I think you can pull it all the way back. We could have an hour-long conversation on that. We won't. But on the origins of like our country and its roots in white supremacy and puritanical roots, and the way that racism and misogyny play a huge role in our lack of understanding around sexual health and sexual liberation, the roots of homophobia and transphobia in misogyny and white supremacy. And so there's a lot of work to do in our education system, with our media. There's a lot of work to do just, you know, from a standpoint of employment and education that create barriers to access. And, you know, here we are, we're live streaming, and that increases a lot of our ability to access folks. But we also have to think of the digital divide. And, you know, there's folks who aren't able to stream this as easily, right, depending on what their access level is. And so there's a huge, I think, overarching lot of reforms that need to happen in order to break down those barriers. And so as we combat transphobia, homophobia, misogyny, xenophobia, as we combat white supremacy, all of those things sort of come into play for a more holistic physical, mental health, and education. So that's like the bigger thing. But of course, I got to always bring it back to white supremacy. But it's real. And so as we're doing that and we're liberating ourselves, and you sort of said it, both of you, Deja and Gabe, is we're empowering ourselves, and we are being out there and vocal and leaders, and just saying like, hey, it's okay to talk about sex and penis and vagina and top and bottom and polyamory and non-monogamy and all of those things. We're creating that space for other folks to feel like they can be their true selves as well.
Absolutely. And language is also developing. You know, it's not, I think we throw around words like penis and vagina because that's what we have inherited. That's what we learned. But now we know that folks are calling their genitals different things, you know, because it's personal, it's their genitals, you know. So when folks are having conversations, I'm going to match your language. You know, I'm not going to use this scientific big words that I'm going to choke on. Like, I can't do that. No, ma'am, Pam. Like, no. We can't. Let's have a conversation. Let's be real. You know, talk to me how you would talk. You know, you want to know. Let's talk. You know what I mean? Like, I'm going to give you straight or real, not straight. You know, this is queer space. So, you know, it's just, again, finding that comfortability.
Absolutely.
Well, you know, we're getting close to the end of our hour together. So this has been amazing to hear everyone's perspectives. And I definitely learned some things and some tips that I can incorporate into my own life as far as self-care and sexual health. So I was just wondering then if everyone has any parting words that you'd like to say before we end today.
Absolutely. I think this was a really great thing to discuss. And I think as we continue to discuss barriers and how to reduce them, having conversations like this in other languages, you know, is going to be super helpful. I think about our Spanish speaking community who already have a difficult time talking about sex because of language or religion or family or whatever, you know, might play into it. So having conversations in other languages around sexual health is going to make the world go round.
Mm-hmm.
I would just say that please go ahead and enjoy your sex life, and please make yourself available of tools and resources to do it safely.
Yeah, echo all of that. And as we slowly reemerge out of this pandemic, just continue to find ways to enjoy and celebrate your own body and explore that, and communicate with those that you want to be intimate with, and do that without fear and do it with compassion. And I think your mental health, your physical health, your sexual health will be so much improved. And it's been very helpful for me in my sexual exploration.
Awesome. Well, thank you again, everyone, Deja, Fernando, Dr. Gabe, for coming on today and sharing your perspectives and expertise. And so I think we're going to leave today with sharing some resources that each of your organizations offers. So thank you, everyone who's tuned in. This has been real fun. And so we hope to see you on more of these live streams going forward.
Talk to you about sex any day, Marvin.
Yeah, totally. I'm game.
This was great. Thank you.
Bye, everyone.
Bye.